neck. Provide for privacy. I'm gonna wash my hands. And I'm going to grab the line. Good morning. Miss Christensen, are you able to tell me your name and date of birth? She does. Her name is Frances Christensen. Her date of birth is 3/24/1942. 3/24/1942. And are you allergic to anything, Miss Christensen? She says she is. She's allergic to betadine and codeine. Today, Miss Christensen, I have the doctor's orders, and they are that we need to administer potassium chloride due to an electrolyte imbalance you're having. I also you have rated your pain as a 9 out of 10, so I have morphine to administer, and I have to change your central line dressing. It has been a week, and our facility policy is after a week we have to change it. The reason for your PICC line is because you're still receiving chemotherapy, so we are gonna go ahead and keep the PICC line in. Are you able to keep your arm still today for me? She says she is, so she's able to follow my commands. We currently have normal saline running, and I have already verified with the Betty book that normal saline, potassium, and morphine are all compatible, and that they are not going to have any reactions to her allergies being betadine and codeine. So we are great there. I'm going to go ahead and I'm going to grab my supplies under this table. I'm going to grab a pair of gloves, some alcohol wipes, and I'm going to wash my hands. So I'm going to go ahead and put on gloves, and I'm going to assess your sight, Frances. Alrighty. Is it tender at all? She says it's not. I'm also noting that it's not looking like it may be infected or infiltrating. Everything looks great, so that's great. I'm going to take off my gloves and to wash my hands again. I'm also noting that there is 100 milliliters of normal saline running, which was ordered and has been infusing, so that is great. I'm going to take a look at the potassium chloride. I'm noting that it expires on June of 2035, so it is within limits to use. I'm noting that it's not looking cloudy, there's no tears in the bag, so that looks great. So I'm going to go ahead and do my 5 rights 3 times. So I have Frances Christensen. Frances Christensen, date of birth is 3/24/1942. 3/24/1942. She's allergic to betadine and codeine. Today I'm giving potassium chloride. It is ordered at 10 milliequivalents and 100 milliliters. It is IV push, it is IV piggyback, and the time is now. I have Frances Christensen. Frances Christensen, date of birth is 3/24/1942. 3/24/1942. She's allergic to betadine and codeine. I am administering potassium chloride. I have potassium chloride. It is 10 milliequivalents and 100 milliliters. 10 milliequivalents and 100 milliliters. It is IV piggyback, and it's being administered for the time right now. I have Frances Christensen. Frances Christensen, date of birth is 3/24/1942. 3/24/1942. I'm administering potassium chloride. Potassium chloride. It is 10 milliequivalents and 100 milliliters. 10 milliequivalents and 100 milliliters. I'm administering it IV piggyback, and the time is now. So that all looks great. So I'm going to go ahead, wash my hands, and I'm just going to put on gloves. Alright. So I'm going to make sure that my clamp is clamped, which it is. I am going to remove my cap and remove this one, making sure that I am keeping sterile. And I'm going to spike it. I'm then able to hang it. And I already have squeezed the drip chamber a little bit. And I'm going to get an alcohol wipe, and I'm going to cleanse this hub that's above the pump. I'm cleansing it with an alcohol prep pad, and I'm cleansing for 15 to 30 seconds. This may vary depending on my agency's protocol. So that is all set. I'm going to keep everything sterile. Remove that. Now I'm going to go ahead and attach. Alrighty. So now I'm going to take my potassium chloride and I'm going to backflow it, or black flush. So I'm going to open my tuber, and I'm going to allow the normal saline to flow, making sure that it gets out any air that might be in my line. And that looks pretty great. Due to limited supplies, I have used this line before, so there may be some air bubbles due to that. I'm going to go ahead and I'm going to drop the normal saline. And then I'm going to get a piece of tape. And I would label. Get a piece of tape and I would label the secondary, and so someone that comes in after me knows when to change the lining. So I'm going to go ahead and I'm going to start the secondary. I've already calculated the rate, and it's to be 100 milliliters per hour. The volume to be infused at is going to be about 80 because the bag is at 100. So then I'm going to go ahead and unclamp. I'm going to press start. I'm going to just take a look, making sure that this hub is unclamped. It is, because the normal saline is running. And so now that's running. So I'm going to go ahead and I'm going to remove my gloves. I'm going to dispose of my supplies. I would wash my hands. And then, had this been a child, I would want to verify that the dosage and everything is accurate. Maybe have a second person in the room to help make sure that they feel relaxed. I would document that how much is running, noting the 3 drips. I would document what is running, how much is running, when I gave it, who I gave it to, how Frances tolerated it, and then I could document my assessment as well of her PICC line, and all looks great. So now, Frances, we're going to go ahead and I'm going to grab the morphine, which I have here. And I'm just going to do a quick check here. So I have Frances Christensen. Date of birth is 3/24/1942. Date of birth 3/24/1942. She is allergic to betadine and codeine, so we're administering morphine today. I have morphine. It is ordered at 2 milligrams in this vial. I have 10 milligrams per 1 milliliter. I did my calculation already. You'll be getting 0.2 milliliters today. It expires of 12/20/30, so we are in with range of the expiration date. I'm administering this IV push, and it is for every hour PRN. You have yet to receive it, so it is time. Alright, so I'm gonna wash my hands. Just gonna gather some supplies as well that I already had in the room. Like I mentioned before, I checked in the beta book and the Betty book, and potassium and normal saline and morphine can all be they're all compatible, so I'm going to be administering it via your PICC line here that's already running. It does not need to be diluted. I will be administering it at a rate of 1 milliliter every 4 to 5 minutes. Some adverse reactions you may see today would be vomiting, any dizziness, or whether you're feeling sedated. If you start to feel these, you have to please let me know right away. Alright, so I'm going to go ahead then, and I'm going to get dose accurate.
In the perfect world, we will go ahead and find camtoprolol 80 milligrams in 250 milliliters of 0.9 normal saline. And the expiration date's good because I checked that. So let's go ahead and 0.9 normal saline, correct, and then we have 25 milliliters per hour. I'm just gonna make sure that that's right for my math, and it is. And then the volume to use is we're going to do 225. So make sure you can check it in time.
Okay. This is a little air bubble that does not want to leave. Again, our supplies have been used. So in real life, this air bubble would get out way easier. But I am dose accurate at 0.2.
We're good on that. So I'm going to go ahead and turn this off and pretend that we did.
Okay, so I'm going to go ahead and put the cap back on. Keep sterile. And I'm going to run through the checks again. I have Frances Christensen. Date of birth is 3/24/1942. 3/24/1942. Frances Christensen. She's allergic to betadine and codeine. I'm administering morphine. I'm administering 2 milligrams. I have 10 milligrams per 1 milliliter. After doing my math calculation, I should have 0.2. And I have 0.2. She is getting an IV push every hour, PRN. She is yet to receive it yet, so the time is now. I have Frances Christensen, 3/24/1942. Frances Christensen, 3/24/1942. She is getting morphine because she's allergic to betadine and codeine. I have morphine. I will be administering, or it's ordered at 2 milligrams. In this vial, I had 10 milligrams per 1 milliliter. After doing my math calculation, that's 0.2 milliliters. And I have 0.2 milliliters. She is getting an IV push every 1 hour PRN. She's yet to receive it, so the time is now. Frances Christensen, 3/24/1942. Frances Christensen, 3/24/1942. She's allergic to betadine and codeine. She is receiving morphine today. I have morphine. It is ordered at 2 milligrams. I have 10 milligrams per 1 milliliter. After doing my math calculation, she should be getting 0.2 milliliters, which is what I have. She's getting an IV push, and it is ordered for every hour PRN. She's yet to receive it, so the time is now. Okay, Frances. Remember what we talked about, keeping that arm still. You're following my commands, so she's able to. I'm going to go ahead and I'm going to put on gloves. Also, Frances, we talked about those adverse side effects. If you start to feel anything, please let me know. And even after, if you start to feel something, please call on your call light. So because it's compatible with normal saline and the potassium, I'm able to just cleanse this hub right here and administer it. Again, I am cleaning with an alcohol wipe and for 15 to 30 seconds because that's what my agency allows for. I'm going to dispose of that. And I'm going to go ahead and insert this. Again, like when I checked in the Betty book, we have to go a millimeter every 4 to 5 minutes. So I'm going to be watching the clock here, going a millimeter every 4 to 5 minutes. Okay, for time purposes, I'm just going to speed it along. Okay, and how are you feeling, Frances? She says she's feeling good, so I'm going to go ahead and I would dispose of my supplies. I can take my gloves off. I would wash my hands. If Frances was maybe confused, I could have a second person in the room with me to help maybe distract her from it. Then for documentation, I would document how she tolerated it. I would document the time, what I gave, how much, and her assessment of the site, noting that it wasn't infiltrating, it didn't look like there was infection, everything looked great. So Frances, we're going to move on to our final, which is changing that dressing. So I have gathered my supplies. Alrighty, Frances, I'm just going to wash my hands. And I'm going to put on gloves. And I'm going to assess your site again. This time, I'm going to be looking for any redness, edema, schistosomiasis, what the drainage may look like, and approximation. Everything looks great. So I'm going to take off my gloves. And wash my hands. Because her dressing is still intact, I would not need to wear gloves for this. But I'm going to start at the PICC line insertion site and go up 6 inches. From there, I'm going to go around and check the circumference, noting that. Oops. And then I'm going to measure from the insertion site to the catheter hubs. All right, and that looks great. I double checked with her baseline and the numbers do match. Had they not matched and they were off by about a half an inch, I could suspect that there may be infiltration happening, which there's not, so everything looks great. So I'm gonna go ahead and wash my hands. And I'm going to open up my sterile kit. So Frances, this is gonna be a sterile procedure. Are you able to wear a mask? She says she is, so I would wash my hands. And to pick up her mask and I can apply it. I'm going to wash my hands again. I'm going to apply a mask on myself and wash my hands. If Frances were not able to tolerate the mask, I could ask her to turn her head away from the insertion site to keep it sterile, but she was able to. So now I'm going to don clean gloves. Then I would wash my hands.
I tried administering it and it didn't really
All right, Frances, we're gonna go ahead and I'm gonna start to peel off this dressing. So I'm gonna hold down here at the base and I'm gonna peel towards your insertion site. If Frances were prone to skin tears, I could use an alcohol prep pad to help make it easier to get the dressing off and not tear her skin. Again, too, if she were a child, I could have someone else in the room helping me just to make it go a little bit easier for them. Okay, so I'm checking the dressing for the color, the amount, and the consistency, and everything looks great, so I can go ahead and dispose of that. I'm also going to take a look here at the site, noting again any redness, edema, schistosomiasis, the drainage, and approximation, but everything looks really great, Frances, so there's nothing to worry about there. So I'm going to take off my gloves. Without turning my back, I'm going to grab hand sanitizer and I'm going to wash my hands. And now I'm going to get my sterile gloves out. going to dispose of that. I'm also going to open up the dressing so I have that ready to go when the time comes. Okay. I'm going to go ahead and open my sterile gloves. Be mindful not to turn my back on anything. Okay. Okay, so I have my gloves on and sterile. Scoot that out of the way a little bit. Alrighty, so I'm going to reach in and I'm going to grab my tweezers, and I'm also going to grab my alcohol wipe. Depending on my agency protocol is what I would use for this, and I'm going to make my way in a circle motion, clearing up any drainage, working my way from the inside to the outside. Again, I would use whatever my agency protocol states and forever how long. I can go ahead and dispose of that. Next, I'm going to get the cleansing solution. To activate it, I would press these two little buttons, and I would begin making a hashtag symbol, applying enough friction and pressure. Again, had this been someone who is elderly maybe and more prone to skin tears, I would not do it as rough. You would want to do this for about 30 seconds, but again, it all just depends on your agency protocol. I'm going to take that. I'm going to allow this to dry. Once it's dry, I'm going to get my skin prep, and I'm just going to make a square. This allows for the tetraderm to adhere to it. So I can go ahead and dispose of that. Okay, are you feeling okay? She says she is. So now I'm going to go ahead and I'm going to get the tetraderm. Throw that away. Making sure that I'm not touching the inside of it, I'm only touching the outside. And I'm going to go ahead and put this in the middle. And then I can take off these outside pieces. Okay, and then I have a label for it. I'm going to put this label at the base to help hold the catheter in place, as well as I'm labeling it with the date, the time, and my initials, because that is what my agency protocol wants. And then also, depending on my agency protocol, I could change the hubcaps. So I can go ahead then and remove my gloves. I can throw my supplies away, wash my hands. I'm able to take Francis's mask off now, wash my hands. I can take my mask off now, wash my hands. And then I can document. So I would document what the dressing looked like before, what the site looked like, how she tolerated the new dressing, any complications that we may have had. Francis said she's okay, so I'm going to place her in a safe position, hand her her call light, I would wash my hands, and then I would